Hi, I'm Monta, student pharmacist here at the pharmacy. I see that you're here to pick up two new medication sent by Dr. Wallace. Before I get started on that, can I please have your name and date of birth?
Yeah, my name is Neil Lee, and my date of birth is October 1st, 1998.
Thank you. I just wanted to ask for like 10 to 15 minutes of your time since this is a new medication, so that way you have like an optimal understanding of how effective this drug is to you and how is it beneficial and all the risks associated with that. Is that okay?
Yeah.
Okay, sounds good. So I wanted to ask, are you taking any like non-prescription medication like over the counter or supplements right now?
I am not.
Sounds good. And what about any other prescription meds that you have?
I'm not taking anything else.
Sounds good. And then when your doctor prescribed this meds to you, what did what did Dr. Wallace tell you about this medication?
He just told me that this is just for my heart, but other than that, I don't know much about it.
Sounds good. And what about, did he tell you how to take this medication or what to expect from this medication?
He did not.
Sounds good. Well, that's okay because we're gonna go over it together, and then if you have any question later, you can just tell me, okay? Okay, the first one I want to talk about is apixaban or Eliquis, and you're gonna be taking 5 milligram tablet by mouth 2 times a day in the morning, or like one in the morning, one at nighttime. And then what this medication is for is to treat your blood clot. So that means it's just a blood thinner, so that way you don't have any clot in your system. If you take medication, but if you miss a dose, just take it as soon as you remember, and if it's almost time for your next dose, just wait until then and take the regular dose. Do not take too much, like to make up for the missed dose. And then when you want to store it, store this medication in a container at a room temperature, like away from heat, moisture, and direct light, and keep the medicine out of reach of children, very dangerous for them, and never share your medication with anyone else. There are a couple ways you can monitor this. It's mostly your doctor, so you want to go visit your doctor so that way they could do a lab test for you, and then make sure you keep up with the appointments so you're not missing out on any of that. And then for these, you might for side effects, you might notice a couple of things. So for example, you might have like GI bleeding, headache, or things like that. And then if you notice any of these side effects, that's like allergic reaction, change on how much you like pee, or if you're like having chest pain, your breathing problem, coughing up blood, vomiting material that looks like a coffee ground, like a tiny coffee grounds, or have like kind of like red or brown urine, blood, or terry stool, then you want to call your doctor and let them know of the symptoms, because it is important that you get like treatment for that. And then this medication again may cause increased risk of bleeding, so do not stop using this suddenly without asking your doctor, because you might have a higher risk of stroke for a shorter time after you stop using this medication. So we want to be very careful of that. And then you do have 11 refills, so after this you'll have a whole year covered. For now you're going to get 60 tablets, which is 2 per day. So before we get moving with nitroglycerin, can you tell me just a little bit about apixaban?
Yeah, so it's a blood thinner, and I take it by mouth twice a day, one in the morning, one in the evening. And that is to help me prevent from getting blood clots in the future. I should also be monitoring out for any blood, because it is a potential side effect, and I should contact my doctor if that ever happens to me.
Thank you, Mr. Lee. I'm glad you have that understanding. Now we're going to talk about nitroglycerin, or Nitrostat is what brand name is known as. And this medication is for your chest pain, like a lot of chest pain. So for this, it's a different dosage. It's not a tablet, it's sublingual. So that just means you place it under your tongue for fast relief of chest pain. And you are going to have 0.4 milligram sublingual tablet. And then going to take this, it's a little bit different than your usual tablets.
Mhm.
So you're gonna take one tablet as needed for chest pain every 5 minutes. And then the max dose you can do is 3 doses. You cannot go over that. If you do, call 911. And then to do that, wet the tablet with saliva and place it under your tongue, inside your cheek. Let the tablet dissolve, so do not chew, crush, or swallow the tablet. Wait 5 minutes, and if you still have pain, take a second tablet. Do not take more than 3 again, and if you still have pain after you took a total of 3 tablets, then this is called emergency, so make sure you call 911. And then you cannot drive yourself to the hospital with this. So if you miss a dose, this is a PRN, so as needed dose, just wait until the next dose and take it as regular. Do not take again extra, because you might get emergency, you might have to call an emergency for that. As for storage, you want to store your sublingual tablet at room temperature in the original glass container, not in a different container. In the actual original container, away from heat, moisture, and direct light. So keep all medicine again out of reach of the children and from anyone. And then to see if you're to monitor for yourself in the house, you can see if your chest pain has subsided, you have less chest pain, you feel a lot more relief from pain. And then you can also keep track of it with heart rate or blood pressure. If you have blood pressure machine, the automatic machine, you can use that to monitor for that. And then when you do have these side effects, such as nausea, vomiting, and you feel weakness, or you have allergic reaction, increased chest pain, a faster slow heartbeat, and then you might feel a dizziness, lightheadedness, or feel fainting, or you feel confused, have trouble breathing, then you want to talk to your doctor, call them and let them know of these symptoms, so that way we can have another preventative method for this. You'll have 11 refill for this, so it should cover the whole year. So can you tell me a little more about nitroglycerin and how you should take it?
Yeah, so I was told that I needed to take it once underneath my tongue and let the saliva dissolve it for whenever I have any chest pain. And then if that chest pain does not go away within 5 minutes, I will just take another one, but I can't take more than 3. And then if I still experience chest pain, I should call 911, go get admitted to the hospital. But I actually cannot drive myself. But I might experience some dizziness with it as well. Besides that, I believe I need to just monitor if my chest pain goes away or not.
Sounds good. I'm glad you have an understanding. If you have any other question, we can have we're available all day long, but we can monitor again next month when you come pick up your medicine. So we'll see you in a month.
Thanks. I honestly don't have any critiques for you.
Oh, period.
You actually were spot on with that one.
Period. Okay.
Okay. All right. Good morning.
Good morning.
My name is Neil. I'll be your pharmacist for today. I just wanted to double check on you real quick. I see that you are coming to pick up 2 prescriptions from Dr. Wallace. But before we get into that, can I please get a name and date of birth?
Double gel, 11/17/2000.
Wonderful. And before we start, this is just to make sure that you have a great understanding about the medication, what it's for, how to take it, and any potential side effects to look out for, okay? Is it alright if I take a few minutes of your time for that?
Yes, sir.
Awesome. So before we get started, are there any current medication that you're taking? It could be over the counter, it could be prescription, or it can be any herbal supplement that you're taking at the moment.
No.
None? Alright. And then what has your doctor told you about this medication? What did he tell you this is for, how to take it?
For one of them, I know I have been experiencing my chest pain, so I know out of two, one of them is for chest pain, but I'm not sure like how to take it and what the other medicine is for.
Awesome. So we'll go ahead and go over that, and just so you have a great understanding of it, okay?
Sounds good.
So your first medication is Eliquis, or in other words, apixaban for the generic name. It is a blood thinner, so it helps to treat and prevent any blood clots in the future. He prescribed you a 5 milligram tablet, and you're going to take that 2 times a day. You can take one in the morning and one in the evening by mouth, okay? And so, in case you do forget a dose, you're going to take, in case you miss one dose, you're going to take the next dose if it's close to your next dose. But if it's, my bad.
Okay.
If it's close to your next dose, go ahead and ignore that missed dose. Do not double up, because it will cause some harmful effects. But if you do happen to forget, take it as soon as possible unless it's close to your next dose.
Sounds good.
Alright. And then whenever you store it, you're going to store it in a closed container in a room temperature, away from the heat, any moisture, and direct sunlight. So preferably somewhere up in the cabinets as well. So your doctor will do some lab tests regularly just to see if how the medication is working out for you. So make sure you go to all your appointments in the future. Some side effects you might experience with this is some GI bleeding or headache. So if you're noticing any allergic reaction, or if you're urinating too often and your urine is like pink or red, or you're also coughing up blood, any chest pain, or have any like blood and stool target looking like stools, definitely seek medical attention immediately. For this medication, you have 11 refills. This should cover for the rest of the year. Besides that, just so I know that you have a great understanding of this medication, can you tell me what I have just told you?
Eliquis is for my chest pain. No, for blood thinner. So it's a blood thinner, and then I take 2 tablets per day. So one in the morning and one in the afternoon. I store it in a kitchen cabinet, which is away from like heat, moisture, or anything like that in its container. And then I have 11 refill. If I have any symptom or sign of like bleeding or headache or chest pain, then I need to talk to the doctor, and then I get that going.
Yep. Also, for this specific medication, you're going to be given 60 tablets, which is a 30-day supply as well. Now, for your next medication, it's nitroglycerin, 0.4 milligrams, and you get 25 tablets for it. Now, for this medication, of course, it's called nitroglycerin, but it's also called Nitrostat. And you're going to take this it is the chest pain medication that you were talking about earlier. So whenever you do are experiencing any chest pain, you're going to take this underneath your tongue. You're going to place it underneath your tongue and let your saliva dissolve it. You're going to take one every 5 minutes, but no more than 3 times. So what you're going to do is when you place it and let it dissolve, wait 5 minutes and see if the chest pain goes away. If it has not gone away, go ahead and take your second dose, and then wait another 5 minutes. And then if you're still experiencing it, go ahead and take your third dose. But if you're still experiencing any chest pain after that, go ahead and call 911 and get yourself admitted to the hospital, but do not drive yourself. When you store this medication, you're going to try to keep this in its original glass container, away from the heat and any moisture and any direct sunlight. Preferably away from children. Do not share this medication with anyone else as well. Since this medication is a as needed kind of dose, if there's no point of missing it, because you'll know when to take it whenever you do experience the chest pain as well. You might experience some nausea, vomiting, and weaknesses with this medication, but you should really let your doctor know if you're experiencing any allergic reaction to this, if you're experiencing any increased chest pain or any irregular heartbeat, so whether if you're fast or slow heartbeat, if you're experiencing any like severe dizziness, headache or confusion, or if you are also having trouble seeing, or if you're having a hard time breathing or getting a little blue or getting sweaty, these are all signs that you should definitely let your doctor know about that, okay? So for this, you get 25 tablets, and you get 11 refills, so it should cover you for the whole year. And just so you have a great understanding of this medication, can you tell me what I have told you so far?
Nitroglycerin is for my chest pain, and it is as needed medicine, so it's not like I have to do a regular schedule. I just take it when I have like chest pain and need for that. The max dose I can take is 3 doses, and then when I do take it, I cannot be driving around because it will cause like dizziness and headache and confusion. And then if I take more than 3 doses, I need to call 911 because that's not good. And then I have 11 refill on this. If I notice any increase in chest pain or headache, I need to let my doctor know. Also, like if I have allergic reaction, I need to let my doctor know about that. And then I store it in its original container, away from light and moisture and away from children, and then not give my medicine to anyone else.
Wonderful. Well, we'll follow up with you in 30 days to see how you're doing with the medication as well. But if you have any further questions in the future or before that, we're open from 9 to 8 p.m. So feel free to give us a call and we'll assist you in any way we can, okay?
Sounds good.
All right, you have a good day.
Thank you. You did great. But I think you just need to be a little more confident when you're like saying the things out loud instead of like stuttering. But you had like solid understanding of like each of the medication. Just the confidence part is where you're lacking, causing you to not be as like in the flow as you should. Sometimes you're like all over the place, like one place to another. So it's just build up your confidence and you should be able to get the flow in.
All right.
Yeah. Good job.